Trauma is pervasive. It touches every corner of our world, leaving its mark on individuals, families, and communities. In the fields of psychology and social work, we encounter the ramifications of trauma daily. Our clients carry the weight of past experiences, and we, as compassionate witnesses, are not immune to their impact. Trauma-informed care recognizes this reality. Trauma-informed care is not merely a set of techniques, it is a fundamental shift in perspective. It compels us to move beyond the question of what's wrong with you, to what happened to you. This shift in focus recognizes the profound impact of trauma on an individual's beliefs, behaviors, and overall well-being. The prevalence of trauma underscores the urgency for professionals to adopt a trauma-informed approach. By understanding trauma and its consequences, we can create safer, more supportive, and ultimately more healing environments for those we serve. Ignoring the impact of trauma risks perpetuating cycles of harm and hindering our clients' progress. Trauma is not limited to a single event. It encompasses a wide range of experiences that overwhelm an individual's capacity to cope. Abuse, neglect, violence, war, natural disasters, and systemic oppression can all leave lasting scars on the psyche. Trauma's reach extends beyond the individual, impacting families, communities, and even those who work closely with survivors. The impact of trauma is often invisible, manifesting in a myriad of physical, emotional, and behavioral symptoms. Anxiety, depression, substance abuse, chronic pain, and difficulty forming trusting relationships are just a few examples. Recognizing these signs as potential indicators of past trauma is crucial for providing effective care. Trauma affects the brain and body, altering our perception, emotional regulation, and even our memories. The amygdala, responsible for threat detection, becomes hypervigilant, while the prefrontal cortex, involved in rational thought and decision-making, may struggle to function optimally. This dysregulation can lead to impulsive behaviors, emotional outbursts, and difficulty processing information. Trauma-informed supervision recognizes the potential for vicarious trauma in clinicians. By understanding and applying its core principles, supervisors can create a supportive environment that fosters both the supervisee's professional development and their own well-being. This approach emphasizes safety, trustworthiness, choice, collaboration, and cultural humility. Safety is paramount in trauma-informed supervision. Supervisors must create a space where supervisees feel safe to explore challenging cases, express their emotions, and acknowledge their limitations without fear of judgment. This involves establishing clear boundaries, actively listening without interrupting, and responding with empathy and validation. Trustworthiness is built through consistency, transparency, and clear communication. Supervisors demonstrate trustworthiness by honoring their commitments, being upfront about their expectations, and addressing any concerns or conflicts directly and respectfully. This fosters a sense of security and allows supervisees to engage more fully in the supervisory process. Section 4. Safety, the cornerstone of healing. Creating a safe environment is not merely about physical safety. It's about fostering a sense of emotional and psychological security. Supervisees need to feel confident that they can share their experiences, thoughts, and feelings without fear of judgment or reprisal. This requires supervisors to cultivate an atmosphere of respect, empathy, and non-judgmental curiosity. Supervisors can establish safety by setting clear boundaries and expectations for the supervisory relationship. This includes outlining confidentiality guidelines, defining roles and responsibilities, and establishing clear procedures for addressing conflicts or concerns. When supervisees understand the parameters of the relationship, they feel more secure and supported. Active listening is crucial for creating a safe space. Supervisors who listen attentively, without interrupting or imposing their own interpretations, convey respect and demonstrate a genuine desire to understand the supervisee's perspective. This attentive presence allows supervisees to feel heard, validated, and empowered to share their experiences openly. Section 5. Trustworthiness. Fostering a secure base. Trustworthiness is fundamental to any therapeutic relationship, and the supervisory relationship is no exception. Supervisees need to trust that their supervisors have their best interests at heart, will provide honest and constructive feedback, and will be present and supportive throughout their professional journey. This trust forms the foundation for growth and development. Transparency is key to building trust. Supervisors should be open about their theoretical orientation, supervisory style, and expectations for the supervisory relationship. Clearly communicating these aspects upfront helps establish a sense of clarity and predictability, fostering a sense of security in the supervisee. Consistency is equally important. Supervisors who are consistent in their words and actions, who follow through on their commitments, and who maintain a predictable and reliable presence create a sense of stability and dependability. This consistency allows supervisees to feel secure in the knowledge that their supervisor will be there to support them, even when faced with difficult cases or challenging emotions.